Have you ever looked at your CBC report and felt lost? Don't worry, in this video, we will explain the key components of a three-part differential CBC report in just 2 minutes. It categorizes your blood into 3 key components: white blood cells, red blood cells, and platelets. Each of these tells us something important about your health. White blood cells are your body's frontline defense against infections and inflammation. WBC count, the total number of white blood cells, essential for detecting infections or inflammation. A white blood cell count outside the normal range indicates an inflammatory infection, and a decrease indicates that the body's immunity is low. Lymphocytes help fight viral infections. Elevated lymphocytes indicate a viral infection, while lowered lymphocytes may indicate a lowered body resistance. Mid cells include monocytes, responsible for clearing debris and dead cells. Granulocytes, including neutrophils, eosinophils, and basophils, are key in combating infections and inflammation. With a clear understanding of WBC, we now move on to red blood cells, the oxygen carriers of your body. RBC count, the total number of red blood cells in your blood, which carry oxygen to your organs and tissues. Hemoglobin is the protein in red blood cells responsible for oxygen transport. It's a common marker for detecting anemia. A high level of hemoglobin may indicate dehydration or hypoxia, while too low a level may indicate anemia or a blood disorder. Hematocrit reflects the percentage of red blood cells in the total blood volume, helping assess how thick or thin your blood is. MCV, MCH, and MCHC values describe the size and hemoglobin content of red blood cells. RDWCV and RDWSD measure variations in red blood cell size. Now, let's take a look at platelets, which play a key role in blood clotting. Abnormal platelet levels can indicate bleeding disorders or clotting issues. Platelet count is the total number of platelets in the blood, critical for blood clotting and wound healing. Platelets that are high may be at risk for infarction, and too low may be at risk for bleeding disorders. Mean platelet volume indicates the average size of platelets, providing insight into platelet production and function. Platelet distribution width measures the variation in platelet size, which can reflect abnormal platelet production. Platelecrit, PLCR, and PLCC further assess platelet volume, large platelet ratios, and counts, offering a deeper view of platelet activity. For a more accurate understanding of your specific health condition, it's essential to consult a professional doctor who can combine these results with other symptoms to provide a well-rounded diagnosis.